Hi, you guys. Welcome back for our daily practice questions. It is day 301, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of the resources that I offer. And as always, y'all know I like to direct you to my business profile by simply going to Google and searching The Nursing Studio. It will bring you here where you can find my contact telephone number, link to my website, as well as testimonials from previous review students. All right, y'all, question number one. A 26-year-old woman presents with dysuria, urinary frequency, and suprapubic discomfort for 2 days. She denies flank pain or fever. Urinalysis shows positive nitrites and leukocytes. What is the most likely diagnosis? Is it A, pyelonephritis, B, interstitial cystitis, C, uncomplicated UTI, or D, urethritis? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely diagnosis? And as I always tell y'all, if they're looking for a diagnosis, you need to run it back and take a look at the assessment findings. So how do they present? What are those signs and symptoms? So we have a 26-year-old woman who has dysuria, urinary frequency, and suprapubic discomfort for 2 days. She denies any flank pain or fever, and then the UA is positive for nitrites and leukocytes. This is classic presentation of C and uncomplicated UTI. Remember, uncomplicated UTIs are those standard symptoms like your dysuria or your urinary frequency, but they don't typically have anything outside of that as like any pregnancy. Think about uncomplicated is considered females with standard symptoms that haven't been treated before or having that additional pain or any significant abnormal presentation, so to speak. Whereas complicated UTIs are your males, your pregnant females, and the elderly. So pay attention to all those key factors when you see them breaking things down in an uncomplicated versus complicated UTI scenario. All right, question number two. A 22-year-old patient with mild intermittent asthma uses a SABA about twice a week. According to GINA guidelines, what is the preferred first-line controller and reliever treatment? Is it A SABA as needed? Is it B, a low dose inhaled corticosteroid daily? Is it C, a low dose inhaled corticosteroid and formoterol as needed? Or is it D, a leukotriene receptor antagonist daily? Take a moment and tell me what you got. All right, and stem of the question here. According to GINA guidelines, what is the preferred first-line controller and reliever treatment? All right, so this says a lot. So we're looking for the preferred controller and reliever, but let's think about how GINA guidelines work. So what stage, what area are we in, right? So we have a 22-year-old patient with mild intermittent asthma. They do a SABA twice a week. So what is that preferred controller and reliever? And your best answer is C, that low dose ICS and formoterol PRN. Remember, in that those first and second stages, the preferred controller and reliever is the low dose combo inhaler of ICS and formoterol PRN. Okay, so C is your best answer. All right, and lastly, question number 3. A 24-year-old woman taking a combined oral contraceptive forgets to take one active pill yesterday and realizes it today. What should she do? Is it A, take 2 pills now and use backup contraceptive for 7 days? B, skip the missed pill and continue as usual? C, take the missed pill as soon as remembered and continue the rest as scheduled? Or D, stop the pack and start a new one tomorrow? Take a moment and tell me what you got, y'all. All right, and stem of the question, what should she do? So you need to get more information based off of that. Sometimes your stem will look like that. So we have a 24-year-old woman who is on a combined oral contraceptive. She forgets just one pill. So what are you going to tell her to do today now that she remembers? Your best answer is C. Tell her to go ahead and take the missed dose as soon as you remember it right now, and then continue the rest. So the one that you would have taken today, you need to take this evening and then continue on your schedule. So C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio. You can give us a call, shoot us a text message, or an email. And as always, everything that I offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.